Hey guys, Dr. Ben here, Functional Medicine Centers. Welcome, glad to have you guys on board today. For those of you out here in Colorado, we are getting ready to get hit by a couple feet of snow, so it's gonna be an exciting weekend. Hope everyone stays safe out there. So welcome, gonna talk today about bowels, and this is something that nobody likes talking about, but in this office, we talk about it all the time. Some people even send pictures. Don't post that down below. Nobody else really wants to see that. But it's important. What is going on when we're constipated, when we have diarrhea? We posted earlier this week on Tuesday, we had got a 28-year-old we're getting started with, came down from Casper, Wyoming. 30 times a day he's having diarrhea. A 23-year-old, same day, 20 times a day he's having diarrhea. We've got people that are constipated, probably even more constipation in this office than we see diarrhea. People come in and they're going 2 times a week, 3 times a week, 4 times a week, a lot of slow bowels. So then we get into why is that actually happening? So welcome everybody. If you have not seen our page before, like or follow it. You can hit the button up at top and it will give you a little beep every time we go live, and you'll start learning and learning and learning. We've also got a YouTube page, all of our videos on there. You can search them by name, way easier to find them than Facebook. And that is going to be our YouTube channel, Functional Medicine Center, Fort Collins. So again, we've got our office in Fort Collins, Phoenix, Arizona, soon to be Nashville, Tennessee, actually Brentwood, one of the suburbs. We have our facility located. We should be opening up on the first part of May. And again, our doctors, our team down there will be doing this exact method that I've been perfecting over the last 20 years. You'll be working with metabolic coordinators that work with my patients here in Fort Collins, work with the patients in Phoenix, do this entire system. So we're super excited, getting the word out, helping people every place we can. Unfortunately, we're seeing a lot more issues, especially on the digestion side. If I see a name and an age coming in and they're in that 18 to 25 range, 9 times out of 10, they're having major GI distress. It's rampant in that age group. We see it all the way across the board, but it's amazing how many young people now are having digestion issues. And we're talking major digestion issues, vomiting every day for a year, some pretty crazy things that are happening. Had a patient on Monday I spoke with, and before Thanksgiving, before she came in, she was vomiting every day. By Christmas, she wasn't vomiting anymore. Hasn't vomited again since then. Started massage school, doing great through there. So let's get into the difference between constipation and diarrhea and why some people even have both. So let me know if you guys have questions at all about anything like this. Hey Lorraine, good to see you. If anybody has any questions, pop those down below and I'll answer those. Constipation, bowels, immune system, whether you should wear 2 masks, 3 masks, anything else out there, just go ahead and ask those questions. I'll answer them down below. So a lot of people will either be constipated and they'll go occasionally every couple days. It's uncomfortable. They have to take something, things like that. Other people, they're going 3, 4, 5, 10, 15, 20 times a day, almost any time they eat. And then other people, they'll be constipated for a couple days and then it just flushes out and they've got to go a whole lot and really clears a lot of things out, and then they kind of plug up again and then they flush it out, and it does this cycle again and again and again. And so what'll happen is the body will try to just get it out. So if we're constipated, for some people, they'll just say, you know what, liquefy it, just flush it out. We know it's not squeezing it through. And this is one of the major problems with constipation is we have something called gut motility, where it's this squeezing motion, and kind of like a snake squeezing a mouse through it, all the way through it once it swallows it, and it digests it through that process. We don't just eat more and then it pushes on it, eat more, pushes on it. It's actually squeezing things through. So that's a big part of what we're looking at is Are we getting that muscle contraction like we're supposed to? We've talked about the vagus nerve. Give me a thumbs up if you guys have heard vagus nerve or vagal nerve tone. We've talked about it here. A lot of other people have read about that. Vagus nerve, cranial nerve 10, comes off the brainstem, and it goes down gag reflex, heart and lungs, but it stimulates that peristalsis. There's some thumbs there. So gag, gargle, hum, you may have read about different ways to stimulate that vagus nerve, but if it's not firing, we're not going to get this squeezing motion, and so that's going to lead to a lot of constipation issues. It's going to be this and just have to wait for that food to push things through, basically like the snake would have to wait, find another mouse and then push it through, find another mouse and push it through, but it wouldn't be squeezing it through like it's supposed to. So really important to have an idea of why it's in balance. A lot of times we'll see people, their microbiome will be out of balance. So microbiome is good bacteria, bad bacteria, a lot of those different imbalances with the yeast, virus, good bacteria, bad bacteria, all these different things are going to throw off whether someone's constipated or having diarrhea. A lot of times that microbiome, people think, oh, I'm going to take a probiotic. So this is kind of, think about stocks, and they always say sell high, buy low. And I'm selling high on probiotics. We use probiotics all the time, but I'm kind of selling high. Why? Check out the commercials, the advertisements in newspapers all over the place. Probiotics, probiotics, probiotics. You got drug companies jumping on the wagon. You've got all these different people that are making tons of money off probiotics, but not really changing a whole lot in the digestive tract. So probiotics are helpful, but in and of itself, they are not going to make the dramatic changes like people are hoping. Most of the time, we've got to kill off the bad stuff first, bring in the good stuff, and then, Kendra, I'm talking about it right now. So kill off the bad stuff first, bring in the good stuff, kill off the bad stuff, bring in the good stuff, using things like oil of oregano. Hey, Tamara, good to see you there. Using things like garlic, black walnut seed, a lot of good kill-offs, and then you bring in the good stuff, and then it's going to be able to settle in more. But remember, we've got over 20,000 different strains of probiotics, of different bacteria that we have found and we've been able to identify. So it's huge, the number, and just to think that, ooh, I'm going to take this one probiotic and it's going to change my diarrhea, it's going to change my constipation, it's going to change my bowels. Not really. There was a study done where they did an upper GI and a lower GI and almost met in the middle, and they took biopsies all the way through that digestive tract, and they compared it to a stool test. So you go into a little bucket and send it off to the lab, and they compared it, and what they found was that every step along that small and large intestine was totally different as far as the microbiome goes compared to that stool test. So some people go, ooh, you gotta get a stool test, gotta get a stool test. And sure, if there's parasite in the stool test, if there's some certain type of yeast or things, you've gotta do stuff about it. But it is not the be all and end all. So that's one of the reasons we don't do stool tests right off the bat, because it's a very small amount of this 22-foot long digestive tract. So the big part that we have to look at is overall change. We've got to feed good bacteria. You've got to make sure you're getting the right amount of fiber and the right type of fiber to get that build up the good bacteria. You need to kill off the bad things. If someone's had microbiome imbalance, they're probably going to have to work on it the rest of their life. I was at a seminar a bunch of years ago, and they had a picture of this wild, wolf ready to eat you, and then this little schnauzer schnitzu dog of some kind, and the person speaking was like, hey, this is your natural original microbiome, this wolf, and if you've been on multiple antibiotics, your microbiome will never be the same. You can try to take probiotics, all these different things, and it's going to be like that little schnitzu in there. And so, not saying it's not worth trying and don't do anything on it, but it will probably never be the same. I had Lyme tick bites, so the bullseye rings around my tick bites, And I took 3 months of antibiotics. This was probably 10, 12 years ago. I've worked on enough Lyme patients to know I did not want to get Lyme disease. I had 2 at the same time, and I had 3 months of antibiotics. Guess what? I trashed my gut. It'll probably never be the same, but I never had Lyme disease, and I know that if I keep my body strong, I will probably never have Lyme symptoms. So I know for me, I've got to always be thinking about and working on how am I going to be able to get my microbiome better? How am I going to be able to keep pushing it, keep working on it, and getting it going forward? So here's some tips for constipation. Drink more water. Some people get up and drink 12 ounces of water every 10 minutes until you have a bowel movement. That can make you go. Magnesium citrate, one of the easiest, simplest things. It doesn't fix the problem, but if you got to go, magnesium citrus is going to do that. MCT oil is going to be helpful as well, and you can do aloe vera juice as well. So try those things for constipation. Things for diarrhea, you got to figure out the why. So you got to go and do some kill off, do some oregano, garlic, do some kill off through there. Work on leaky gut if you've got diarrhea as well. So bring out the bad foods, heal that gut lining. Glutamine, marshmallow root, aloe vera again is really healing for that gut lining. And then you've got to remove the bad pathogens as well and work on that microbiome. There are certain strains of probiotics that are going to be more beneficial for diarrhea that you can use as well, but you've got to get that going. If you're constipated, look up ways to stimulate your vagus nerve. Very good chance that's a big part of what's going on. So if you've got any specific questions, pop those down below. It's always a fun topic to talk about, and no judgment on no matter where you are in this process. You can get better, you can get help. We see it every single day. So stay strong out there. If you need help, we're here for you. Phoenix, Fort Collins, going to be Nashville, but we can work with people all over the world. Take care, guys.